The pain and numbness of neuropathy is not a permanent condition. Listen to Ron's story. I think you'll be impressed.
My name is Ron Satterfield, and I came to the Winter's Clinic because I was having problems in my feet. The doctors had said it was neuropathy. They prescribed Lyrica for the pain. I had seen Lyrica on TV and all, and so I went ahead and started taking it and took it for a long time, in excess of a year and a half. What my problem was, I could have something in my shoe. The best example is I had some coins in my shoe. Put my shoe on, didn't even realize the coins were there. Went to work, worked all day, and that's about a 12-hour day, and come home, took my shoes off, and wondering where the coins came from. Then I remembered that I had taken them out of my pocket and for some reason had dropped them in my shoe the night before. So I didn't even know they were there all day. And now I would rate it as been about 80% cured. I have a little problem in the tip of my toes only, but in the base of my feet, all the way back through my arch, it's gone. The pain's gone. I also was having problems in standing erect. I would tend to crouch over a lot. That I'm more positioned on my heels now. My back doesn't hurt. My lower back, which if I worked in a tilted position, my back would hurt a great deal. That pain is gone. I've also some numbness that I had in my left leg for numerous years, probably, I don't know how long, 8-10 years, is gone in my left leg. On my right side, we're still working on that, but it's getting much better. So,
Great, Ron. How long do you think we've been working with you?
I've been working 7 weeks.
Very good, 7 weeks. So, by the way, for your legs, you were taking, what medication were you taking for your legs?
Just the Lyrica to help my legs and feet. But when I took the Lyrica, I could tell it was helping my feet, but it didn't help my leg. The leg is just there. If I sat in the same position for an extended period of time or drove in a car, numbness and all would go all the way down my leg.
Yep. So when you went to your doctors and you mentioned this was going on with you, what did they tell you?
Said it was probably a pinched nerve, but that's where it stopped. They didn't go any further other than saying I had neuropathy, and I had 2 different doctors tell me that, and the medication was what was prescribed.
Right. So now you have sensitivity in your feet, and you can you can do kind of what I guess normal things with your feet.
Yes,
right?
I can walk through the house barefooted now. Before I couldn't walk through through the house because I didn't have any sensitivity in my feet, and then as that sensitivity came back, I can step on just a tiny little kernel of just a grain of sand and I can feel it. And I hadn't felt that in so many years.
Oh, that's awesome. All right, so what would you tell somebody who had the same situation you had about coming to this clinic and talk to these people?
Well, I would recommend it. I waited a long time. I drove up and down Green Street for a long time, considered it, and then I began to see some friends of mine that have came and some relatives that have came to the clinic. And I said, I've gone everywhere else. I might as well give it a try.
Good.
And it's been great.
And what do you think your future looks like because of your legs now?
I can see other problems that I have that we're working on. I can see them disappearing, and I can see everything becoming back to normal again.
Good. Drug-free?
Not yet, but I'm hoping to get there.
Good.
I've already eliminated right now 2 different medications that I've had, and so we'll see what the future holds. I hope it continues.
Good. Did the doctor want to tell you to come off the medications?
I've got one doctor to agree that I could come off of one medication and try it for a while, and so we're doing that. Another medication I've come off permanently.
Very good. Congratulations. Good. Thank you.
You're welcome.
All right.
I
So,
hope you can.
if you're suffering from the pain and numbness neuropathy, call Dr. Winter at 770-536-6600.